And welcome into To Your Health. And we have with us again this Sunday, we have Dr. Will Rutland. And you graduated. Will is the director of psychiatry at the UAB Montgomery campus medical school. We have it right here.
That's right.
Right here. And thank God you came back from Yale.
Sure.
They wanted to keep him there and we wouldn't let him.
So I'm so happy to be back, to be honest.
I love it. I love it.
Yes, ma'am.
We ended last week, we were talking about, we're talking about Alzheimer's and dementia, and you had mentioned medications that have improved and you're finding different things, and you mentioned lithium, I think.
That's right. This is the most recent sort of development that's hit the popular consciousness.
Right.
No doubt there are other things going on in research labs around the world, but this has really sort of broken through into the popular consciousness that it looks like maybe a low dose of lithium, now of course this would have to be prescribed by a doctor, but may have a neuroprotective effect, which is to say protects your brain and maybe even can help preserve some of your cognitive functions, so some of your ability to think, which is really promising. That's a medication that we know well. We understand lithium. We've been using it for a very long time. There are considerations with lithium. You have to be careful with levels, but if this ends up being a promising intervention for Alzheimer's or other dementias, it could really do a lot of good out there in the world, and so we're happy about that. Although I should say, I don't want to cause undue stress about dementias.
Right.
I'm talking about interventions, but I think it's really important whenever we're talking about disease processes that we identify when people should be concerned.
Yes, that's what all of us would like to know.
So, we don't want to pathologize just normal old human behavior.
Right.
And we don't want to cause people stress. And forgetting things is not pathological, especially these days. It is a stressful, go, go, go world. We're all pulled in 10,000 directions. We're on our phones and our tablets, and it's just, it's hard to keep track of things. And because of that, we can start to worry, am I losing my memory? More likely than not, the answer is no. You're not. You're just living in a stressful world and you're doing the best you can. So really, when we as clinicians start to kind of raise our eyebrows and get concerned is when we notice that losing memory or having difficulty thinking impacts the patient's ability to function. So that's when we really get concerned. Now, oftentimes the patient won't even notice that themselves. It'll be brought to us by a caregiver or a loved one. And so that's a big sort of canary in the coal mine as well. If someone's spouse or family member says, mom or dad hasn't been acting themselves, they left the stove on and nearly burned down the kitchen, or got lost recently while they were out in public. If it comes to us from a third party, we give that a little more weight. But if you just notice that you're parked at a stop sign, you think, where was I going? Or you walk into a room and you think, why did I come in here? Or you see somebody from your past and you can't remember their name. That is not pathological. That's just usually stress and is normal old brain fog. So I want to make sure people don't feel like they're in any danger if they're just experiencing normal cognitive dissonance.
Okay.
It's the fancy term for that. All right. But there are, of course, diseases that can implicate cognition, like the Alzheimer's we talked about, and some others. And so maybe I'll talk just a little bit about some of the other things we think about. Some of these will be things that y'all are familiar with. Parkinson's disease, everybody's heard of before. Parkinson's can come with a dementia component to it. Some stuff that you may not have heard as much about are dementias like vascular dementia, which is usually the product of a long life of poorly controlled high blood pressure or other cardiovascular disease. It is characterized by what they call a stepwise decline in function. So you're doing great, and then all of a sudden you drop and you hit a new baseline. So for instance, you're no longer able to, say, cook for yourself or do other complicated tasks that require multiple steps. But then you can maintain, and then you drop again, and all of a sudden you're really having trouble. So that's characteristic of vascular dementia. You may have heard of something called frontotemporal dementia.
Yes.
So frontotemporal dementia is fairly common. It used to be considered a variant of Alzheimer's. It comes with behavioral changes. So this is where we lose more brain volume at the front of our brain. The front of our brain is what keeps us behaving. So when you're on your best behavior, the front of your brain is what's in control of what you're doing. And as you lose volume at the front of your brain, your behavior starts to get out of control. And so that's frontotemporal dementia.
An example. Give us an example.
So what can happen there is, and this often causes a lot of distress, folks will start acting in ways that are socially unacceptable. So if you get a question about frontotemporal dementia on the board exams, usually involves an individual who is, say, at church, and they stand up and start acting foolishly, like they never would, and all of a sudden they are. So that's frontotemporal. Like I said, Parkinson's and vascular dementia. There are other dementias out there. This is something called dementia with Lewy bodies, which is also fairly common in the general population. It is characterized by sort of patchy ability to function. So all of these can have slightly different, what we call phenotypes, or they'll look slightly different. All of them are treated more or less the same way by trying to control the underlying causes or by trying to slow down the disease progression. But those two interventions that I mentioned last week, that sort of socialization, being active, living a healthy lifestyle, and sometimes low-level medications can help. So don't worry, there is hope for any of these. You know, we have medications that we can try. We have behavioral interventions we can try.
It's so encouraging.
Absolutely.
You know, because thank God that there are some treatments when you recognize and take care of things.
Too right.
Get somebody.
And we've got great folks here in Montgomery who are doing incredible work in neurology and gerontology. And so we're always happy at the UAB Montgomery campus to help get you connected with the right folks.
I love that. I absolutely love that. And thank you so much for the information. And we appreciate you being with us. Take care of yourself. Remember what Dr. Will Rutland is telling us he's telling us what to do to help, so pay attention. Thanks for being with us, and we'll be right back.